Tanzania, and then specific thanks also to both Susanna Dennis from PAI and Susanna Hurd from Global Health Visions, who've done a lot of the work to help drive just the pulling together of agendas and background documents and planning for those meetings. So just to say that the Global Financing Facility fourth Investors Group meeting is going to take place on November 3rd and 4th in Tanzania, and that there is a particular opportunity. So I'll just quickly in a moment go through the sort of key items that will be discussed in that meeting itself, but there were sort of several opportunities that arose around this meeting, and partly it was organized this way because FP 2020 is also having a reference group meeting in Tanzania as well, October 31st to November 1st. So the idea is to have a real synergy of joint meetings, including joint meetings with and including country partners on November 1st to both extract lessons learned and then also have the joint discussions within the investors group meeting around reproductive health, family planning, and issues related to that, taking advantage of that. And we also made a decision to organize a civil society side meeting in advance of the investors group meeting, and again taking advantage of both these meetings on November 1st. So an opportunity for civil society to come together and sort of, I'll say more in a moment, but also assess kind of where we are and also work particularly to develop a civil society engagement strategy for the GFF to continue to sort of build how we can ensure that the GFF takes full advantage of all the different strategies and capacities that civil society brings, and how we can actually make the GFF even more effective and a success, as well as talking about guidance to countries. So let me then take a minute and just sort of walk through some of the key issues that will be on the agenda for the investors group meeting, and then I'll come back to the civil society meeting. And I'll stop for a minute before I'm done and just see if Mesfin or Kadi or Betsy or others that are on the call want to add. So the investors group meeting, again, will take place on November 3rd and 4th. So it will include, as they all do, a focus on the specific country that we're in, Tanzania, so sharing experience from Tanzania with presentations from the Ministry of Health. There will be a portfolio update, which again will be partly so looking at what's been going on in all of the countries, partly supported by the GFF Secretariat, but also hearing from the countries that are in the room. And then again, trying to take advantage of some of being in Tanzania and having a lot of high-level country representation, a session on lessons learned from existing GFF countries. Then there'll be a joint session with a focus on family planning, which will identify key areas of priority for GFF and also in collaboration around family planning issues. Again, taking advantage of the prior FP 2020 meeting. And then there will be a couple of key areas focused on. One is an update and some recommendations from a task team that was formed on commodities. And I'll come back to that because it's one of the background papers that we do have to date. So sort of focus on some recommendations around how to strengthen issues around commodities and delivery. And then there will be a session on financing for RMNCAH with a particular focus on domestic resource mobilization. That will be for information, not specifically for decision. But it has an interesting focus on domestic resource mobilization, looking at issues from the sort of increase in per capita out-of-pocket expenses, the importance of looking, as we look at domestic resource mobilization, both at how to support not only increasing the resources for health, within the overall budget, but how to, the importance of and how to support countries to expand the overall pot of money that's available within the budget, and then health within that, and looking at kind of the where different GFF countries sit sort of in that analysis. There'll be an update, a review of progress on civil registration and vital statistics. There will be a review of recommendations coming from the task team on fragile settings that will be for decision. There will be an update on the private sector engagement strategy. There'll be an update on resource mobilization for the GFF and GFF countries and kind of plans going forward. There'll be a governance update. We will have an opportunity to give a CSO update on the CSO consultation and discussions that have been had, and that will be the meeting. And we don't have most of the documents yet, so I don't have some of the details on that, but I noted a few specifics around this financing for PMNCH, and then I'll just come back for a moment on the recommendations from the task team on commodities. And I think it was particularly an analysis that looked at the country investment cases and seeing that there probably wasn't as much sort of specific development about how to deal with some of these issues and bottlenecks around supply chain and commodities, and that further work and support can be done on that, and a sort of set of specific recommendations that will be brought forward to the investors group, both the Secretariat through various ways of providing support to help countries strengthen the investment case to ensure a stronger focus on commodity access, including also potentially strengthening investment case guidelines, and also looking at, again, what are different strategies to build country capacity on this, and also potentially working with the interagency supply chain group on this. So those are four broadly what would be discussed around the access to PMNCH commodities. And then we'll have other documents coming this week that we can perhaps provide some updates on, or if folks are particularly interested in specific issues. So let me then just say a few words about, and please others jump in who have been part of this planning. So as I said, there is a pre-day on this, which would be on November 2nd, which takes advantage of, it would be a joint meeting of the investors group and the FP 2020 reference group, and it will include opportunities to hear from civil society, as well as kind of a joint evening event where folks will have a chance to get together. So those will be both formal and informal opportunities for information sharing. And then as noted, on November 1st, we're organizing a civil society pre-meeting for the day, which again can feed into the investors group and our ongoing work as well. And that CSO meeting will really focus on lessons learned to date from country partners. It will include hopefully a partner from at least most of the GFF country. The idea is to have at least one person from each GFF country, and we are working to still try to make that happen, as well as partners, important partners that have been working regionally, the civil society reps to the investors group, and some other supporting partners. And again, with a focus particularly on a couple of areas. One is sort of what are the lessons to date? How has it been going for civil society engagement at country level? Where have things been working better? Are there lessons to be learned? What are the challenges that are still happening? Are they country specific? Are there lessons we can learn kind of from challenges across countries about how to improve civil society engagement and how to really inform the guidance that will come from the GFF Secretariat on country platforms? And then there'll be an opportunity to really dig in on a civil society engagement strategy, which will be looking at both a sort of how and what's needed for civil society engagement, and then also some of the, at least initial thinking around the what. What are the roles civil society plays and how can those be specifically supported through the GFF to frankly make country investment cases and health financing strategies and efforts as successful as possible. And then also some ongoing feedback into the guidance around the country platforms, again, to understand from the experience of partners what can further strengthen that to sort of really maximize the impact and the role that civil society can have in making country planning, implementation, and accountability as successful as possible for the GFF. So maybe Mesfin, I'll say Mesfin or Kadi or anyone else who's been part of that planning, if there's anything you would add to that overall update.
Hi,
Thanks very much, Joanne.
Oh, great. I think you have covered it well, and I think the only thing I would add is that we are given 15 minutes in the main investors group meeting to provide update from the civil society meeting. Really, we need to come up clear and concise recommendation that we can take forward to the investors group. So hopefully, you know, the colleagues who are attending the meeting will work together at the end of the day to come up with a kind of, you know, a concise recommendation going forward. So we have a work to do. So thanks. I think all the basics are covered. Thank you.
And it's Betsy here, and maybe just to add on, thanks very much, Joanne, just in terms of that meeting and the CSO engagement strategy, just to say that that's something, you know, for all colleagues on the call to know that is very much going to be a process, and I think the feedback and the inputs coming from the workshop to feed into this investors group are critical, because I think it is a really important juncture. But it's certainly not, you know, not the end of the story or the process, and it will be something that, you know, will be evolving. And I think as we are defining that and the critical different roles that CSOs play, you know, we hope that this much wider community of CSOs will really engage around that, and recognizing we wanted to take advantage of this opportunity, but, you know, it will be limited, as Joanne outlined. We're hoping to have at least one CSO rep that's been engaged in each of the GFF countries to date, as well as, you know, some other partners. But it's, you know, it's still it will be a relatively small number of people. We know that there's, you know, interest and engagement that's much wider than that, and we look forward to, you know, using this platform and others to continue to engage and get inputs and help to shape that as it moves forward.
Betsy, thanks for saying that, because just to add two things on that, well, actually three. One is, to your point about this civil society engagement strategy, we're hoping to use this in-person meeting before the investors group, as you said, to sort of get further inputs and strengthen that strategy, but that will by no means be, as you said, be the end of that process. So the goal would be to have a further draft civil society strategy that we can continue to get inputs from everybody on, with the goal of having something that would even go back to a next investors group meeting in the spring. So it is definitely not final. It is an attempt to have something that we can bring forward to sort of frame, you know, in many ways the contributions that civil society can and does bring to this, and how to make sure that those are really fully captured in the GFF. So I think important to know that there really will be opportunities for folks to continue to contribute on that, and also that we are reaching out to some partners in country. Again, it may not be everyone, but we're trying to get some further feedback from partners, even those that can't make it to the meeting within GFF countries, to just get better sense of, again, lessons learned about how things are going at the country level, and how we can sort of feed that back into specific constructive recommendations.
Great. Thanks a lot, Joanne. Does anyone else have anything to add to Joanne's points before we move to Mesfin's updates on the progress in countries themselves, and then we'll be opening the floor to questions and comments. Okay, Mesfin, over to you, please.
Okay, Liz, I guess you put the PowerPoint. So Good afternoon, morning, everyone, once again, and I will speak briefly about some progress at the country level based on the information that I've been able to gather from the Secretariat and so far what we know. So the GFF countries, I'll start from the list. There has been an update since our last call, and with the addition of new countries that joined the Global Financing Facility. And as you can see, the list, it includes new countries, including Guatemala, Guinea, Myanmar, and Sierra Leone. And you can also see that Vietnam is also in the list, and India is no longer in the list, so which used to be an earlier stage. So basically, countries, India decided probably not to proceed with the GFF, but we have new countries that have expressed interest, especially using their IDA and IBRD loan for PMNCH. So the trust fund, using the opportunity to bring down the IBRD loan for these countries and improve access to PMNCH. So these are the countries that we know recently joined, and just the new countries are work starting, so we don't have much information in terms of the GFF process. Next slide. So yeah, so far I think in terms of investment case, and so far 7 countries have almost complete or in the process of completing their investment case, and mainly Ethiopia, Kenya, and Tanzania have already completed. I think as we reported before, Ethiopia and Tanzania is actually using existing document which was developed through a multi-stakeholder process, and there was no new investment case developed for GFF. It's only Kenya that have developed new investment case, and that is completed. So the other countries are, Cameroon, DRC, Liberia, and Uganda, almost complete. Actually, in the case of Liberia, the investment case have been approved by the senior management at the Ministry of Health, so that is the latest that we have. And Cameroon, a full draft is completed, so final draft is expected this month. And again, in the case of Cameroon, there is quite a lot that went into in terms of the investment case, which includes CRVS. So that is the development on that. And for Bangladesh, their agreement is to use their national strategy, which is a swap, which was already there before the GFF. So this is where they are with the 7 countries in terms of development of investment case. And in terms of programmatic area, I think on all of the 7 investment case, family planning is included, and then nutrition is also included on all of the 7 investment case. So that is quite progress in terms of the focus. And again, the other issue that is being considered is around equity, which is one of the key principles for GFF. And I think the way equity so far has been addressed through the investment case is looking at regions that have been disadvantaged, and I think both the Cameroon, DRC, Kenya, and Nigeria investment case actually developed with that in mind, prioritizing regions that have been neglected. And in fact, in the case of Nigeria, it was an emergency facility loan to address need in the northern region. So that is where it stands in terms of looking at the equity issue. The other aspect is there's quite a lot of discussion around innovation and the engagement of private sector. There was an update from the private sector engagement, quite elaborate process, and where countries are actually what they are doing in terms of engaging the private sector. So as we presented before, there is a private sector engagement strategy which is looking at the role of private sector for a GFF investment case. So that is basically in the area of innovation, in the area of facilitating partnership between global private sector and countries, and then of course the other one is leveraging private sector capability in countries to deliver on investment case. So based on those strategy, the Cameroon investment case are looking at around impact bond for kangaroo mother care with a number of partners, including Grand Challenge Canada and other partners. And there is an aspect of bringing together demand and supply side approach at scale in Uganda. So that is pretty much looking at again, with the private sector lens. I think USAID helped in terms of scoping out this area, and there is a focus on that, and contracting as well private sector to provide service in a number of countries. So these are some of the issues that are being highlighted investment case, and I think there is still continuous challenge around how the investment case being used as rather than prioritization, but it's like seen as a national strategy, which is sometimes include everything. And I think moving from that into key intervention using the GFF principle of smart, scalable, financing or intervention, moving in that direction seems to be a challenge. So again, I think we mentioned about the country guidance document, which is currently being developed by the GFF Secretariat and is still under consultation. So as such, we don't have any clear process in terms of understanding actually how country platforms are functioning. So these are information that we got directly from the Secretariat, not from the countries in terms of the status of the investment case. So I think going forward, as this investment case is finalized in these 7 countries, and alongside some countries are also developing their health financing strategy. So far it's more on the costing and the technical aspect of health financing. So we had a health financing specific call to understand the status and how countries are using, and I think still a long way to go in terms of developing health financing. But I think the only progress is on the investment case, and we hope to get more information when we are meeting face-to-face from the countries itself. In Tanzania, there will be more focused actually discussion on Tanzania. So that is probably which I would like to share. I'll be happy to answer anyone has question, but I think unless Joanne has any comment, I will stop here. Thank you.
Great, thanks very much, Mesman. Joanne, would you like to add anything to what Mesman's presented before we open?
No, I think that's great. Let's go ahead and open it.
Okay, terrific. So thanks very much, Joanne and Mesman, for outlining both the kind of status update on where things stand at the country level, as well as some headlines on what we're expecting to see in terms of the investors group agenda and the ongoing work on the CSO side. The floor is now open. We've got about 15 minutes for discussion. If people can just identify themselves when you make put a question or comment forward. I'm not able to see the kind of chat box from the attendees on this as well. Maybe GHG colleagues can help to manage that side, but the floor is open.
Hi, this is Liz from GHC. We have received a few questions, and just a reminder that if you do have a question, please do put it in the chat box. We don't have the ability to unmute participants at this time, But if you do identify yourself through the chat box and have your question in there, we'll make sure that we pass it along to our speakers.
Oh, okay, Liz, do you mind then? I can't actually see those for some reason in the view that I'm seeing. So if you want to go ahead and sort of take over and read a few of those questions out, that would be really helpful.
Sure, I can definitely do that. So our first question is, what is the current feedback on standard of country investments, and how have CSOs managed to get space at the table to influence investments in countries?
Do you mind just reading a few out, and then we'll pass it to Mesman and Joanne?
Sure. The second one is, regarding the equity focus in several countries, has this focused on geographically disadvantaged regions only, or also services that benefit those living in extreme poverty wherever they may live? And then one more question. Spencer from the One campaign asked, for countries that have not completed or almost completed their investment cases, like Nigeria, what is their status on their investment cases, and what else besides prioritization difficulties is holding them back from completing these?
Great, thanks. Let's take those three. So Mesman, do you want to start? So there's a question about where do we stand, and what's the barrier in terms of moving forward the investment cases. And the second question related to the investment cases was a little bit about the engagement and the learning that we've seen so far from CSOs. And then the question on equity is a clarification question of whether that's geographic or looking at other measures, including socioeconomic measures, regardless of the sort of geographic presence. Mesman, when you start, and then we'll go to Joanne. Thanks.
Okay. Yeah. Thanks for those questions. And yeah, if I may start, and I think in terms of civil society engagement in the development of investment case, again, it varies from countries. I think there are some countries where there is some progress in terms of participation. But again, even those countries we think have done good job in terms of inclusive process for civil society. It is, one-time consultation, and then, not necessarily engaged in terms of the actual prioritization of interventions. So it is actually quite an intensive process of developing investment case, right from the identification of need up to the prioritization and selection of the intervention and the costing. So in that spectrum, some countries like Senegal or Cameroon, there has been consultation and inclusion of civil society, but again, in some countries perhaps maybe very limited. So it really varies, and we don't have as such a very good system for us even at the global level as civil society coordinating group to be able to track and understand what's happening in the country. So I think, it would be great if if there is anyone in this call from any of the countries who can comment in terms of their experience, that would be much appreciated. But from our view, it is a mixed engagement so far, and I think more need to be done to make sure that that is meaningful. And I think part of that is basically making sure that the country guidance document explicitly acknowledge the role of civil society and have a process for engaging from selection as well as the business process. So that's yet to happen, and I think that's continue to be our advocacy agenda. And the second point about the equity issue, I think, the investment case so far I have seen, it is actually geographic disadvantaged region that have been prioritized. And as you have seen from Kenya as well as Nigeria, Cameroon, DRC, and not as such necessarily looking at a national and then where are the pockets or the group that are disadvantaged because of other vulnerability criteria. So I think that's my understanding from what I've seen. So I think it is still work need to be done for those countries that have not developed. But I think it is encouraging to see that some services that have not been as such a priority, like family planning, nutrition, being prioritized in the investment case. That is one progress that I can say. But the other thing is in terms of Nigeria, I think for Nigeria, they have not yet determined or decided the approach they are going to pursue in terms of developing their investment case. So because of the urgency, the emergency in the north, they got an emergency grant to address that immediate need. In fact, actually, what I understand is that even service provision was given through non-state actors, through contracting types of arrangements. So I don't know why Nigeria is actually what's holding them in terms of developing the national investment case. So that is my understanding so far. Maybe I'll let others to comment. Joanne, if you want to add.
Mesfin, I think you did a great job. Just a couple of comments to add and not repeat. I think that first question about the current standard of investment cases and the role CSOs have played, I would say a couple of things. One is I hope we will come out of this next, I would encourage people on this call to share information. And I would also say I hope we come out of this next meeting with even some more insights and really some specific lessons about where CSOs have been most effectively engaged, how that's worked, how that can even, those lessons can be repeated elsewhere and shared, and sort of how we can continue to develop best practices at countries on this. I mean, I do think CSOs have played a key role, particularly around, issues like reproductive health and making sure that some of that was included. I know civil society partners were really key in Kenya in ensuring that nutrition was also in there. So I do think folks have managed to sort of help make sure that some of those key issues are on the table. And, and I think it's a sort of complex question in terms of the standard of investment cases, but I do think supporting countries on prioritization is always, a huge challenge, but some of that work, I think the GFF is trying to look at other key issues like commodities and bottlenecks in ensuring that and trying to help develop further resources and sort of thinking about what kind of resources countries need to further address those in investment cases and make sure that they're in place. And I would say sort of the next steps after the sort of development of the investment case are, multi-stakeholder, including civil society and communities' roles in implementation, especially reaching the hardest to reach, in being part of accountability mechanisms, and frankly, in also building support for the investment cases, and both for domestic and, external resource mobilization. And then the only other point I wanted to make is, I do think that the GFF has a particular opportunity around equity to be supporting. So I think you really are seeing some of that geographical targeting. But I think there's a particular opportunity the GFF could have in helping countries to look at effective, in real-time ways to disaggregate data, not just by gender, for example, but also by wealth quintile, and looking at how you can, we can be identifying who's being served and where the needs are, even building on some of the sort of geographic targeting and making that even more impactful.
Terrific. Thanks so much, Joanna and Mesfin. Let's take another round of questions.
Sure, we've gotten a few more, and I'm putting them up on the screen now for those that can see it on their computers. So the first question is from Lindsay Freeman from the Torchlight Collective. She said, we're convening a youth strategy session on October 30th with young people from Tanzania with the goal of developing a set of priorities and an advocacy strategy on AYSRH. For both the FP 2020 RG and the GFF Investors Group meeting. And she's curious if there's any way to include young people in these various CSO advocacy spaces. The next question comes from Melissa. Is there technical assistance to countries who are working on the finance strategies in support of the investment cases? From Aminatu, You stated that family planning is incorporated in all country investment plans, but you must be aware that there are many concerns regarding the limited funding for family planning. Can we have an idea of how much SRR are taken seriously into account and funding provisioned adequately? And the last question is from Louis. In the previous investors group meeting, there was a session of individual donor organizations providing support to country-specific GFF efforts. Are there any updates on how this support is being implemented? Mesfin briefly mentioned USAID support in Uganda in today's presentation.
Terrific. Thanks so much, Liz. Joanne, let's start with you this time. Address any points you'd like to from this round of 4 questions, and then we'll go to Mesfin.
Sure. I think really interesting in terms of this youth strategy session, and you know, I would say as in many places, it is a gap in terms of engagement. I think we can, maybe others can answer, but I think we can look at that as far as the sort of the broader CSO group that's been trying to coordinate kind of from country to global level, and we will further build out some of that planning at the CSO meeting on the 1st to see how we can do that even better. But thinking explicitly about both the sort of youth strategy, but youth leadership in that space, and maybe there's a way that we can also think smartly about how to feed some of the feedback from that October 30th meeting explicitly into the meeting that we're having on November 1st to think about, I mean, both specific feedback around Tanzania as an example, but more broadly about recommendations on explicit youth engagement, and would really welcome that. Mesfin, you can probably say as much or more, but I think on the question about technical assistance on health financing strategies, I think there's every intention to do that. I think there's an acknowledgement that the investment cases are ahead of the health financing strategies, and that probably more capacity is needed around the health financing strategies. So I think there is already some technical support that's being provided. There's an intent to do more, but I think there was also a recognition that there's frankly gaps in the kind of technical support that's needed on health financing strategies. And I think really important for us to think about how to help build and support that kind of country level capacity on this, but also how to ensure smart civil society engagement, not just in the investment cases, but in the health financing strategies, and working with other kind of government bodies like parliaments to support that effort. And then maybe I'll leave the other questions. Oh, I guess I would just say on the issue of family planning, again, I think there's a really clear recognition of the gaps in financing, the challenges particularly around, you know, adolescent reproductive health, but in all these areas. And I think we should have this very same question when we come out of this meeting, because there is the fact that we're having a joint meeting and a joint set of sessions with FP 2020, I think is a good sign, and I hope what will come out of that are some very specific, more information, but also some specific recommendations about how we can do this even better, and what are some of the kind of supporting guidelines to, to countries that can help support them to do this even more effectively.
Thanks, Joanne. Over to you, Mesfin.
Yeah, thanks, Joanne. I think you've highlighted well. I think we are looking forward actually to that joint meeting with FP 2020 to understand a little bit more about the aspect of family planning. But I think unless one look at the investment case critically, it's very difficult to say whether it's adequate or inadequate. So that's what I can say. But on your question, Louis, about the financing of other donors, actually it is there are many donors who are using the GFF investment case or process to finance country priorities. I think, as I mentioned, USAID in Uganda, they are actually helping in terms of private sector assessment, so getting that information to the government for their consideration of the private sector market or resource to support the investment case. USAID also has supported Tanzania through in-country trust fund. So that trust fund, which was kind of aligned with the GFF investment case, was part of the package that went into Tanzania in terms of financing the RMNCH plan. So that's another example. If you take Kenya, there is a multi-donor technical assistance fund established within the Ministry of Health. So that is basically a couple of donors, including DFID and USAID, I believe World Bank, put together that money to help Kenya to develop, proper investment case. Again, JICA, the Japan International Corporation, also providing parallel financing, again for Kenya, which is again aligned with the GFF, priorities. And again, also Cameroon. Also, there are donors who are also using GFF process. Specifically, I think the development impact bond that I mentioned is actually Grand Challenge Canada and a number of kind of investors who have involved in that bond. Again, in DRC as well, there is example of USAID, UNICEF, using what they call, joint RMNCH service delivery model. So it's not as such necessarily a pooled, but I think it's a pooled kind of thing, but it is prioritizing the investment case, aligning their resource to finance the country plan. So these are a couple of examples. I'm sure there are more, but these are the kind of that I remember, which might help you to understand the scope of or involvement of other donors in financing the country priorities. Thank you.
Great message, Joanne. Thank you so much, and thanks everyone for these questions. I think they're really highlighting some of the complex and layered issues, including what is GFF specific, but what that intersection is with broader national priorities and plans, broader CSO engagement in terms of advocacy and accountability, and then this kind of alignment issue related to funding. Lindsay, just to add to Joanne's response on the youth strategy session, I think, yeah, we're happy to also take offline perhaps to see how we can sort of increase that synergy between the CSO engagement strategy and the engagement of youth, and how we can strengthen that, as Joanne said, including in this kind of global coordinating group that exists and that PMNCH helps to support. Which leads me to a good segue, I think, which is to give a few minutes to talk about, we talked a little bit earlier about the CSO engagement strategy, but there's also some hopefully helpful work that's been done in terms of CSO engagement, kind of toolkit. And I wanted to turn it over to either Susanna Dennis from PAI or Kali Torre from the PMNCH Secretariat to just give an update on the toolkit.
Yes, I think I'll take that one because Susanna Dennis is on a flight. So relatedly, we have been trying, Lindsay, for AY representation on the CS coordinating group, and a call has gone out for that about 2 or 3 weeks ago, and we've gotten nominations in, so hopefully that'll be built in. But it would also be useful for us to discuss participation, cross-participation in Tanzania, given that you'll already be there. On the civil society engagement guide, we've talked about a number of the ways in which this group is trying to strengthen civil society engagement in the GFF, ranging from the importance of contributing to the development of the guidelines for country platforms, which provide governments with an overview of how to structure national platforms, through to the strategy. One of the tools that I think we've talked about or mentioned would be appearing repeatedly on these calls is an actual tool that would face civil society and provide them with the information that they require to better engage in these processes. So the Civil Society Engagement Guide is finalized and will be shared in the coming week with the next iteration of the bi-monthly newsletter developed by Civil Society Coordinating Group on the GFF. It's structured to provide background information on the GFF, including on the various governance structures from the global level all the way through to the national level, provides an overview of what civil society engagement has been to date, including some of the barriers. Interestingly, it provides some boxes that civil society can use, one which includes information to rationalize civil society engagement in ARM and CAH platforms, part of the challenge being that in certain cases, partners don't see the value add, and so this provides them with those tools. It also provides information on recommendations for effective civil society engagement in platforms, pulling from the minimum standards that were developed last year. It goes through the process for the GFF, and at each of the stages discusses what the potential civil society engagement can be. So it talks through the country selection, which is a very closed off process that happens at the global level in the governance fora, but then goes through to the country platforms and the ways in which civil society can influence the development of the country platforms, the health financing strategies, the investment cases, and then the repartition of activities that are undertaken by each of those partners. We hope this is going to be a tool that facilitates civil society engagement in a range of countries. There was a question around what the civil society engagement in the development of ICs has been, and what we see are some of the facilitating and some of the factors for that. And part of it is left to be found out, and hopefully we'll get more insight from the meetings that we're going to next week. But we see some trends, one related to leadership, and so the countries where we that are very engaged, that have the opportunity to hear a lot of the civil society's perspectives on engagement, have tended to strengthen civil society, or to engage civil society a bit better. We see countries where civil society have had the opportunity to organize themselves and have consultations and have mechanisms by which they within themselves can organize and then reach out to the government, have seen increased participation within the IC development processes. But we also heard that lack of information was one of the major barriers, and this document, we hope, provides people with either the information or the entry point to where they can access that information. So look out for that next week, and we hope to get your feedback on how useful it is.
Kadi, terrific. Thanks very much. That brings us to the end of our hour. I wanted to flag that we'll be holding the next webinar on November 14th. So on the other side of the IG meeting and the CSO meetings mentioned, and some of the information discussed will be shared in advance of that. I want to thank Global Health Council and PMNCH for organizing the session, and also really thank Joanne and Mesfin for being just fantastic CSO representatives and a real commitment to engagement with this broad community. So thanks everyone so much for joining today.
Thank you.
Thanks, and Betsy, thanks so much to White Ribbon Alliance for all of the support more broadly, but specifically for making the CSO meeting even a possibility. So thanks a lot on that.
Yeah, thanks
Great.
everyone.
Thanks everyone. Take care. Bye-bye.